to the Peak Day podcast, where we talk about fertility and natural family planning with our friends. Today's guest is Dr. Trish Rawicki. Dr. Rawicki is a family medicine physician in Dallas. Following residency, she worked as an attending physician with a residency program caring for both seriously ill patients in the hospital and underserved families in an outpatient medical clinic. During this time, Dr. Rawicki's primary interest grew to being restorative women's health and fertility. So she developed and trained in her specialty with courses in NAPRO, FEM, and functional medicine. She takes a root cause, integrative approach with the goal of restoring health. Dr. Rawicki provides restorative and reproductive care and fertility care through My Catholic Doctor. Trish and her husband have 5 children. They are involved in the marriage ministry at the University of Dallas, their alma mater, and Trish teaches a theology of the body curriculum at her children's school. In her spare time, she enjoys cooking and running around the lakes near her home. Thank you for joining us, Dr. Rawicki, on the Peak Day podcast.
Absolutely. I'm happy to be here.
Right. So when I contacted you about being on the podcast, you said that you and your husband were interviewed for the CCL Family Foundations magazine almost 10 years ago.
Mm-hmm. Yeah.
You were in med school at the time, and you were also training to become a teaching couple.
Yes. Yeah.
So what has happened since then?
Yeah. So it definitely felt like a blast from the past. I really loved working with CCL back in med school and teaching couples. So since that time, we've had 5 children, as you mentioned. I went through residency. My husband and I are both working from home and very involved in our children's school. And a lot has happened. I think probably once we had our first child and I was in residency, we were no longer teaching with Couple to Couple League just because life became a little too busy at that time. But
I imagine.
Yeah. Mm-hmm.
Yeah. So looking at the way back, you converted to Catholicism in high school.
Yes.
And then you learned about theology of the body when you were taking your NFP course. Was this when you and your husband were engaged?
Well, actually, I learned about theology of the body in college. So a little bit before we were engaged, there was a physician, an OB, who came to speak on our college campus, University of Dallas, and he spoke about the physiology of sexuality. And then his wife has a master's in theology. It's actually the Pilkingtons, if anyone knows them. They're prominent in this world. And they kind of presented this integrated picture. Okay, here's the science, here's the physiology of sexuality, and she presented the theology of, God's beautiful plan for our bodies and how learning about our bodies can help us actually know God better. And so I think this integrated picture, was very powerful to me. There were so many things that I just had never considered. One of them being that the body is good, much less that our bodies and how God created us to be in the image of God actually can help us understand God better. So those were just 2 things that I had never really considered. And it changed the course of my life, I'd say.
Right. Yeah. In that original interview, you said that you had learned that you deserved to be respected and nurtured as a child of God, and that NFP was central to that discovery. How has that played out further, like over the last 10 years?
I just think that I'm still on a path to understanding myself as being created in the image of God. And what does that mean for my life? And in one sense, I think that this deep understanding of our own dignity, how God created us and how loved we are, and his desires for us, how God wants to divinize us. It gives us a sense of our own, of magnanimity, okay, that we are created for greatness, okay, and God through us wants to achieve that greatness. And so I think, seeing that play out in my marriage, okay, with God's help, with God's grace, I can have a beautiful marriage, okay, but we can have a beautiful family life. We can achieve great things. And I think recognizing, just seeing kind of the poverty of my own understanding of my humanity prior to this realization, it just shows us, I guess, as a message to me, this is what we are on our own. But with God and realizing how God made us and who we're created to be, the difference is so great. And yeah, so I would say it gives me a real sense of magnanimity, like this desire for greatness that God intends for us.
Are you able to transmit that message of dignity to the girls and the women and the families that you serve in your practice?
I certainly try to. I hope so. I would say that I can do this. I would say many of my female patients, and I'll get more into this, but I would say the most powerful place I try to do this is in the Theology of the Body course that I teach at my children's school. So my oldest is in 5th grade, but I teach the 8th grade and the 10th grade girls. And then there's a corresponding course for the boys as well. And I do think, that's a message we really try to convey very powerfully. Look how amazingly you've been created. Look at this incredible plan that God has for you. Don't settle. Just see your own goodness and your own value, and strive for that beauty that God has for you.
Yeah. How do they receive that message?
Well, everyone's different. Some are really ready to receive it, and for some, I would say maybe it's the first time they've really heard this, and you can tell when there's certain girls in the group that are kind of on the edge of their seat, like they're really responding to this. And then, of course, others aren't in a position to receive it at the time, and we're just planting seeds, and you never know what'll flower. So,
right,
yeah.
Do you feel like doctors and other like healthcare professionals have a certain amount of influence in respect to promoting natural fertility awareness for young people, young women in particular?
Yes. Certainly just there's a greater credibility when they see someone who has a lot of advanced training. And I would say that when we are speaking about difficulties that a woman is having with their cycle, okay, or, fertility, but even before fertility, okay, let's say a young woman who's having very irregular cycles or painful cycles, or they're having very bad PMS, when they hear the message that, have you ever thought about the fact that your hormones play a huge role in this? Right now, we're seeing from your abnormal menstrual cycle that you have an imbalance of hormones. This plays a huge role in your mental health, okay? And that, I think, has a lot of traction with young women. I think it's getting more and more out there in the mainstream where people are realizing, for example, I think, studies coming out maybe 10 years ago about the big link between the pill and depression, the pill and anxiety. So this is starting to be a little more well-known, but I would say for many of my female patients, they're coming to me for anxiety or whatever. And I'm like, oh, well, have you ever thought about the fact that you have a very, short luteal phase or this irregular cycle? This probably plays a role, or at least it's one piece of the puzzle. And they'll say, how come no one's talked to me about this? How can I learn more? So you definitely get a lot of traction there.
Right. What a great influence medical professionals can have in that area as well. We'll talk about your functional medicine in just a minute. I want to still stick with you, and a little bit of your history. So when you were in med school, you were newlyweds and you'd had your first child. Did you ever imagine the impact that your decision to use a fertility awareness based method would have on your personal life and your professional life?
No. I mean, I think I went into medical school thinking I would be a surgeon or, something, nothing like I'm doing right now.
Yeah.
And there were times when I think I really didn't understand the direction that my life was going in, that I felt God calling me to certain things, and it did not make sense in the grand plan. um, just even feeling a desire to be more at home with my children, or to have more children, or God is calling me to family medicine. I never thought I would be doing that, and I'm not saying that I didn't want to do those things. There was a desire of my heart as well, but it was very different from the way I thought things were going to turn out, and it was confusing to me, and I didn't see how it would all work out. But I just think what I'm doing now, of course, who knows what God has in store in the future, but I love what I'm doing now. And I couldn't have seen how great it would be, 10 years ago.
Right.
Yeah.
So your husband, Bennett, was he 100% sold on using natural family planning? What was that like?
Yeah. So his parents had shown him, some theology of the body videos starting in middle school. I mean, he had a great formation, and I don't think he understood exactly how it would work, but there was never a question in his mind that, contraception is bad for women. And of course I wouldn't have my wife do this. And, and he's just, I mean, he's a really amazing guy. So.
Yeah. Do you see the effects of your shared involvement in NFP in your family life now, so many years later?
Yes. I mean, I think just the fact that he always saw me, in our early dating life as a whole person. Okay. That he, of course we weren't really into this conversation until we were closer to marriage, but that there was never something about me that needed to be fixed or needed to be removed or protected from within the marriage, that no, she's always a whole person. And I'm thinking about this quote that's in John Paul II's meditation on givenness. And I'm going to kind of paraphrase because I forget it exactly, but it's something about that men are, responsible for the keeping of their sisters in Christ, their wife, their sisters, their friends. And, it's in the orbit of these holy men, in the orbit of their holy masculinity, that women can really see their own dignity and their vocation and then achieve greatness. Okay. So I think it just really plays together that when we have someone who sees their own masculinity and their dignity in that, and then also sees the dignity of femininity and the wholeness there, that we can really fly.
Right. Exactly. Yeah. You're both starting off from such a great, solid foundation.
Yeah.
So tell me, what exactly is functional medicine?
Sure. I mean, I guess functional medicine is holistic healthcare. Okay. So let's kind of try to restore you to a state of health, not treat symptoms with a bunch of different medications. Now, I'll tell you, I don't call myself a functional medicine doctor. I would call myself more of an integrative medicine doctor. And I think there's a bit of a false dichotomy. When I was working in an underserved population, okay, and I had very sick individuals. They were beyond 12 medications because they had high blood pressure and heart failure and horribly controlled diabetes and, anxiety, all the things that go with that. And I was talking to them about diet and exercise. Okay. And I was talking to them about how they can, use diet to help their symptoms. But of course they also needed to be on medications. Okay. Because their health was that poor. And I remember I just really, this patient just really sticks out to me that um, I was talking to him about, how he should be eating for his diabetes. And he asked me, what is fresh food? What do you mean by fresh food? That had never been something that he'd been educated about. And he'd really only ever shopped at Family Dollar for his groceries. He was in a food desert, didn't have a car. So, and my colleagues there, I'm sure we're also talking to their patients about diet and exercise. So I don't want to say, oh, now we're doing things the right way. No, I think we're caring for the people in a holistic way that we can.
Yeah.
But where I see the stark contrast between conventional medicine and functional medicine is in women's health. That's where I think really the distinction lies, because I just think women go into their gynecologist or their OBGYN and they say, I have heavy periods or I have abnormal periods, and they're given a contraceptive. They're given an IUD or the pill. Right. And I don't really understand it because, for example, with PCOS, we know that a woman with PCOS is going to have a much greater likelihood of mood disorders, cancer, endometrial cancer, which, they are preventing with the pill. So there's that. But you could also prevent it by restoring hormonal balance. Right. But, and long-term chronic health diseases like diabetes and hypertension. And then just this whole conversation, which is wonderful, about maternal mortality and our poor maternal health outcomes in this country. Right. If we were fixing these problems, before women get pregnant, rather than treating them with the pill and then giving them fertility treatments when they want to get pregnant, right, we would lower that gestational hypertension, preeclampsia, gestational diabetes, and we would have better outcomes. So,
sense that your patients appreciate your integrative approach to medicine?
Yes. I mean, I think some of them are blown away, which I was too when I first started. Oh, you can actually fix PCOS. I mean, when I first started doing this, but I mean, I have patients that they've had 3 children through some fertility treatments, maybe IVF, and they have PCOS, and then we treat them. And I can get into some of those treatment modalities. And they said, I had the first 28-day cycle I've ever had in my life. Okay, well, sorry you didn't do this 10 years earlier. You could have saved a lot of heartache. So
right, yeah. So finding the root causes of all of those symptoms, rather than just giving them a pill or putting a Band-Aid on it, basically, goes so much farther in helping these women with their hormonal and fertility issues.
Yes.
So when obviously they're experiencing better health as a result of doing it a more natural way.
Yes. So in terms of restoring women to a normal cycle where they have normal estrogen levels, normal progesterone levels. I mean, I hear anecdotally, oh, I'm sleeping like a baby for the first time ever, or my anxiety is greatly improved. So there's that. And then I think even just from we know estrogen is, normal estrogen levels are good for our cognitive health. It's good for our bone health. So we know that we're also doing preventative healthcare by restoring normal cycles.
Right. You touched on this just a little bit about maybe the general population shifting slightly towards having a mindset of, a more natural approach to their health. Do you see this happening in the professional medical side of it as well?
I don't know. And I don't know. From what I hear from my patients, no. And I mean, it might be because they're seeking me out because they didn't like the approach that their, conventionally trained doctor had. Right. And I think part of it is that it's not always easy to treat. Okay. That sometimes it's a journey. Right. Sometimes it requires multiple medications and diet and exercise changes. But I'll say, I don't want to speak out of turn, but I do think there's a bit of paternalism there. And I'll say from medical school and residency, there was a big discomfort in my colleagues whom I would talk to about teaching their patients how to chart their cycles for family planning. Mm-hmm. And even like not having their patients on the pill. It's like, that's a huge liability. What if they get pregnant? And so I think there's kind of this distrust that women can be okay with the way that their body is intended to function. So
it's going to take kind of like a mind shift, really, in how they're being trained and what they're actually learning.
Yes.
And I had another guest who said that, appointments have to be a little bit longer than 15 mm-hmm. minutes as well. So you can get to, the bottom of symptoms that are becoming apparent, right?
Like even initial visits, when I'm doing the workup, I have to explain to them how to get their labs done. We're talking a little bit about charting, introducing that concept. We're talking about, and yes, I'm in a privileged position where I can do that, and not everyone is. So yeah, you're right.
That's a big shift that would need to be made.
Yeah.
So you just touched on this a bit ago. How important is a healthy diet and lifestyle mm-hmm. to overall health, especially for a woman's fertility?
Yeah. I mean, so important. We're living in a time in life where, until 100 years ago, no one was ever able to say, oh, I want this yummy breakfast and this yummy lunch and this yummy dinner and all these yummy snacks in between. It's just, we're living in this whole new world where this never was an option for people before. And yes, we just can't fill our bodies with junk and expect everything to work well. Right. So I'll say this, that and I'm speaking a lot about PCOS because it's so common and I see a lot of this. Mm-hmm. Now, we know that women who have PCOS sometimes are born with a dysfunction at the level of the brain where they don't have a normal FSH, LH pulsatility. Okay. So that's kind of putting them behind the 8 ball. Okay. They're going to have weight loss resistance. They're going to have abnormal reproductive access. So I'm not saying we can always just treat with diet. We do need to use medications a lot of the time. Okay. Mm-hmm. To bring people up to the same starting line. But yes, I do think that diet, just our carb heavy or sugar heavy, diet that we all are swimming in a soup of is largely responsible for a lot of the PCOS that we see today.
Right.
Yeah.
Do you find women and men are going to other sources for kind of like self-education mm-hmm. Because they're not getting it from their traditional doctor?
Yeah. I think that, and a lot, it's great. I love for patients to have agency and seek out the things that they, but I see a lot of women using books and podcasts and, just functional naturopaths and things like that. Mm-hmm. Yeah.
So, how much of your practice involves restorative reproductive health?
About 50%. Yeah, I see. Yeah. So I see a lot of women that just have abnormal cycles and they know that that's a problem. And and even that I think is a little bit new maybe on the playing field, that it's getting out into the world where no, if you're not having a period every month, or if you're suffering extremely every period, this is a problem. Okay. And we can do things to help you fix it. Right. So that is, this kind of the menstrual cycle as a sign of health, ovulation as a sign of health, I think is slowly creeping out into the world.
Yes.
Thank God. And, so I've got, quite a few that just come to me because, they don't understand their cycles. Okay. And they don't understand why they're only bleeding every 60 days. So they just think, okay, correctly, I want to achieve normalcy. A handful of fertility patients, trying to conceive. And then I do some primary care as well, just, a lot of mental health, which
Mm.
hormonal balance plays a huge role. Diet plays a huge role. Diet and exercise play a huge role.
Yeah.
Um, Different nutritional deficiencies, gut health, all of that.
Right.
Dr. Pilar Vigil, she started the Reproductive Health Research Institute, and they just do a tremendous amount of research. And I would say it's like functional. I mean, so, we're not using Band-Aid approaches. We're using medications, okay? But we're saying, but why aren't you ovulating? What is the ovulatory defect? Okay. And then we're looking at thyroid and prolactin and insulin and androgens, those male type hormones. And we are fixing the hormones to get you to ovulate normally. And then there's other aspects as well, like, autoimmune, okay. Like, a root cause approach where we are repairing those hormonal deficits in order to repair ovulation.
Mm-hmm. Mm-hmm.
Yeah.
At what age in your experience are you seeing fertility issues in women, and are your solutions helping?
Yes. I mean, I would say women will come to me in their late 20s, 30s usually. Okay. So I'd say my youngest maybe has been like 26, but before that, yeah, maybe they just think, oh, it hasn't happened yet and it's okay. But I'm seeing a lot of women starting around age 26 and then into the 30s. Of course, a ton of PCOS. And I mean, PCOS, I have to say, when we just treat and it's an umbrella as well. There are different causes as well. A large bucket is insulin resistance. We treat their insulin resistance really aggressively, okay?
Yeah.
And they can become pregnant, okay? And then the other, piece is they can have high androgens. And treating insulin resistance can help with this, but sometimes we need some additional medications to help them with these androgens, like lowering their testosterone, for example, and then they can become pregnant. And then, there's an autoimmune piece as well, and that is more difficult to treat. But there are some solutions there, but it is more difficult. But yeah, I mean, I have a lot of women who suffer with PCOS that we just fix their cycles and they become pregnant. Yeah, really beautiful.
You mentioned testing. Is that a pretty big part of finding solutions?
Yes. Yes. So, we do lab testing different hormone levels. We look at insulin pretty deeply. Doing a 2-hour glucose tolerance test with insulin. Okay. So we're looking at the insulin levels along with it, because high insulin, and this is just an interesting piece, kind of from a functional root cause perspective. I think most people are very familiar with treating prediabetes or diabetes. Okay. But we have a spectrum, and diabetes is here at this end. Prediabetes is here, and we can have insulin resistance for 15 to 20 years before either of these present. Yeah. In the meantime, this high insulin is causing elevated cholesterol. It's contributing to mental health disorders. Okay. Like we see that if we treat the insulin resistance in individuals who have refractory mental health disorders, such as bipolar, that their symptoms are better. Okay. So it's causing mental health. It's causing weight loss resistance. It's causing, minor issues like acne. So if we treat this earlier, we are, this is truly preventative healthcare.
Right. Yeah. So before they get to that number where, okay, you are a pre-diabetic, oh yes, you are a diabetic, there are other things that you can look at like in blood testing that could show that these things are on the rise, and this could be, the beginning of trouble. Is that what okay.
Absolutely.
Yeah.
Yeah. So I just think our healthcare system, I hope it catches up. I mean, because a lot of these things also, okay, well, we're not going to pay for medications for insulin resistance. Okay. A lot of the time. And it's yes, I just hope as we publish more. I was just talking with Mike Manhart at the Catholic Medical Association conference last weekend about, that I need to really be a little bit better at cataloging my patients and publishing, because we do need to publish more so that the medical establishment can catch up.
Right.
Yeah.
Right. Yeah.
Yeah.
Yeah. I've seen, when we look at some of our books, a lot of the studies are older studies. And I think, not that that makes them invalid, but it'd be great if there was something, more up to date.
Yes.
Yeah.
Yes. Mm-hmm.
Do you see any men or any fertility issues in
Mm-hmm.
men?
Yes. Yeah. So I see men primarily for metabolic, so again, insulin related issues and
Mm-hmm.
fertility adjacent concerns.
Mm-hmm.
And again, I mean, I want to be really cautious not giving any specifics, but
Mm-hmm.
you, like, I see men that they have had low testosterone and low sperm count, and that was the cause of their infertility. And they've never had a prolactin checked, and their prolactin is sky high. So this is a hormone that we know causes fertility issues, and they've just never had it checked. And it's so baffling to me. I'm like, like, it's not rocket science, but yeah. So I do see men, and a lot of the time, there are, okay, occasionally there are quick fixes.
Mm.
Sometimes it's harder, but we can help them as well. Mm-hmm.
Right, right.
Yeah.
So when you're working with a woman who is
Mhm.
experiencing infertility,
Yes.
um, do you also suggest let's work with your husband as well?
Yes.
Okay.
Hmm. So, if the woman has something very clear, okay, they have 60-day cycles. Okay, that's fine. We can work you up. We can help you restore normal cycles before we're doing anything more, I guess I would call it invasive, like, um, even like doing follicle scans for fertility and trigger shots to trigger ovulation. We really need to be looking at your husband, because this is a lot of burden on you,
Right.
when there could be other things that we could doing to optimize the fertility of the couple.
Right.
And I mean, I have a really good friend who was trying to get pregnant for years. So she was a college friend. I hadn't talked to her in a long time. And she said, oh, they've been trying to get pregnant for 2 years. And her doctor had said, well, it's almost always the woman. And I was like, oh, no, like, it's not true. 50% is male factor. So, we can do some initial things, but yeah, we need to be, this is the couple's fertility. And I always think that what we are doing to normalize the menstrual cycle and the testosterone level and the sperm count is good for your health. It's not just about babies. We are helping your overall health.
Good point.
Yeah.
That's right. Yeah, because it does affect your health as
Yes.
well as your
Yes.
fertility in particular.
Absolutely.
Right.
Mhm.
Excellent. Yeah. So you talked about anxiety and depression. So what are you seeing as the root cause of that, and how do you approach treatment?
Mhm. Well, anxiety and depression. I mean, it's a lot of puzzle pieces. Okay. So, there's certainly hormonal imbalance, I guess. So if we have low progesterone levels, which stems from an ovulatory defect. Okay. So if we fix ovulation, we can usually fix the progesterone defect or deficit. But anyway, if we have low progesterone, then, women can really struggle with a lot of PMS, really bad anxiety and insomnia. Okay.
Mhm.
Sometimes it's not as simple as just giving them progesterone. Okay. So it can be a little more complicated. Sometimes it's not. But so there's that piece. As I mentioned, blood sugar, balance is very important. So if we have high insulin levels or we have hypoglycemic episodes, that can really precipitate a lot of anxiety and depression. Another thing, we see a lot is like MTHFR is kind of coming out into the public conscience as well. So if we don't methylate our B vitamins well, this can play a big role in anxiety. So these are there's other things like gut health, I always say, just even if I'm doing like a well adolescent check, okay, I'm talking about the best thing you can do for your health is eat real food, okay? Like food that doesn't come out of a package, okay? Eat real food and exercise. Those are the best things you can do for your health. And sleep is very important too. But So of course, all of this plays a role, and we just live in a new world where we're all trying to navigate it. Okay, how much are we on our phones? Are we like looking at social media? I mean, there are big papers. It's not a mystery. The more hours that we are on social media, the more we struggle with anxiety and depression. And this is so true for adolescents. Okay.
Right.
So yeah, there's just a lot of things that we're navigating in this new world. And yeah.
Yeah, that leads me to my next question. How can
Yes.
parents provide a healthy environment to combat this anxiety and depression that we're seeing
Yeah.
so much of now?
Yes. Yeah, it's so sad. And again, I have, my oldest is about to turn 11, and
Mhm.
I'm dreading like entering to this phase where it's going to be like he's going to be different than some of his
Yeah.
peers who will have a phone and may have social media. I mean,
Mm.
and the beautiful thing is that you're seeing more and more celebrities and um, just more people on the news talking about that. Yeah, they're not giving their kid a phone because they know it's bad for them. And, so that's the exact same thing I've told my children who aren't really asking yet. They're too young, but, that, oh, we know that staring at a phone all day and being on social media is bad for you. I care
Right.
about you too much. I love you too much to let that happen to you. So, I mean, I'd say that, we need to be willing to be the bad guy and say no.
Yeah,
And
you need to
yeah,
be the parent. Yeah.
yes, to parent, we have to be willing to parent.
Yes.
And I mean, I would say also a big problem that we see with children and adolescents is I want to say that they're not like in touch with nature. Okay. We're just inside so much and like overscheduled and doing too much homework. And, we're not like giving our kids free range to play and let our kids be outside and be in nature. And it's dangerous for them to not be. So yeah, I hope that's not too out there, but
Right. Right.
yeah.
And how about having a strong spiritual life?
Oh my
Because that
goodness. Yes.
correlates to better health physically,
Yes.
mentally. Yeah.
Yes, I think that. Well, I'll even speak from example. My son, my oldest, who's like I'd say he's a little bit type A. Maybe would struggle with anxiety. Like, and he said to me before, Mom, I just know that when things are not going well or I had a bad day, I know God has a purpose for my life. He has a plan for me, and that always gives me a lot of comfort. And
Wow.
yes, I think that giving our kids this broad picture that like we have a God who loves you and who has a purpose
Mhm.
for your life, is
Mhm.
a gift we give to them, gives their life significance, gives them meaning. So, and even like cohesion, even just like adolescents struggle so much because their bodies are changing and it's really awkward and it's uncomfortable and we don't know what's going on. Okay,
Yeah.
but there's a purpose behind it. Let's teach you about what's going on with your body. Yes, it's not fun, okay? But we'll get to the end and it's so you can be the woman or the man that God created you to be. So giving them that kind of like cohesion. Things aren't just happening to me and it's horrible and
Mhm.
um I mean it may be horrible, but but we're on a journey, okay? And God has a plan for you.
Right. Knowing that there is a plan. Right.
Yes. Yeah.
So if you had a platform that all families could access, what would you think is the most important message about health
About health.
you'd want to
Yeah.
convey?
Some of the things I mentioned, eat real food, move your body, go outside. But then as like for parents, don't be afraid to um, teach your children about their bodies. It is a real gift you give them. Okay. And if you don't know, there are so many different resources for you. I think one thing that is really lacking, and even amongst great families, is that I want them to feel empowered to teach their adolescents about their bodies. Okay. I think that, God made us embodied souls. What we do to our body, we're doing to our soul. What we're doing to our soul, we're doing to our body. Okay.
Mhm.
And I think that a lot of parents have maybe, and they, to a certain extent, they just don't know. They don't know the changes. Okay. But there's so many resources out there. I'm sure Couple to Couple League has some.
We do.
So yeah. So I just like, I think it's really a gift that you're giving your children to like enter into this conversation with them about what is happening to their body. Allow them to ask questions and see their body as good. Because I think when we don't see the dignity of our body, then we'll do whatever with it. We'll throw it away.
So thank you, Dr. Rawicki, for being on the Peak Day podcast and sharing your wisdom with us. It's been a pleasure.
Yeah, thank you for what you do, Martha. It's God's work, so I appreciate you.
Absolutely. Thank you so much.
Thank you.